Welcome back. Well, it's not often we hear about prices going backwards, especially when it comes to healthcare. However, there may be some hope for Australians who need to pay a visit to the dentist.
New data reveals the consultation price for a new patient has barely increased, and in one state, it's even going backwards. But is the answer really to shop around when it comes to your health? Claudia Vradoljak has been looking into it.
Seeing the dentist isn't everyone's cup of tea.
How's everything?
Yeah, good.
All good? No concerns? All under control?
Yeah.
But it's important.
It makes me really sad when I see people neglecting their oral health, and then they come in with so many bigger problems that could be avoided so easily.
Patricia Vivaldi has been a preventative dentist for 24 years. But recently, she's noticed cost is a concern for patients.
This year and last year, we could actually feel that quite strongly, with interest rates going up and people worrying about mortgages and cost of living. We could feel that people were not spending so much on things that were not so essential. During COVID, was the other way around. People had a lot of time and money to spend on dental treatments because they were not traveling.
And if you've ever thought about skipping an appointment for your pearly whites, you're not alone.
Many Australians, particularly those on low and middle incomes, are really struggling to afford dental care and have for a long period of time. In some of our research, our dental practitioners telling us that up to 40% of their patients are really struggling to afford dental care, and that's really increased over the last 12 months as cost of living pressures are really starting to bite.
And we know that more and more Australians are turning to their retirement savings to fund dental care.
A couple of years ago, it was $100 million a year. In the last financial year, $817 million was withdrawn from super accounts to pay for dental treatment. That's really risking people's future retirement to pay for necessary dental treatment that they need now.
Associate Professor Matt Hopcraft is a public health expert from the Melbourne Dental School.
I think dental practitioners are really mindful that patients do experience the cost of dental care directly, that it isn't well subsidised by the government. And so they do everything that they can to keep those fees reasonable. But they're also experiencing their own challenges as the cost of their own wages for staff goes up, cost of equipment, cost of materials, and the cost of regulation and compliance.
So, how expensive is a dental visit in Australia? CleanBill is an Australian company that researches healthcare costs. They've looked at how much clinics charge adults without private health insurance.
Whilst that might seem like a bit of a narrow analysis, it's actually the case that 45% of Australian adults don't have private extras covers.
They found a standard checkup and clean has increased from less than $230 in 2023 to almost $240, costing patients $10 more now than it did 2 years ago. That might not surprise you, but what is surprising is how little change there's been in the price of new patient visits.
For the most part, a new patient visit is a standard checkup and clean as well as bite wing x-rays.
Nationally, the cost of those appointments increased by just $4, edging past $300 in the same period. The biggest increases were seen in the top end, WA, Tasmania, New South Wales, Victoria and South Australia. But in Queensland, the price crawled up by just 10 cents. And in the ACT, it went backwards by more than $20.
A large proportion of dental clinics will heavily discount the costs of their new patient visits so that they can bring new patients in the door.
So, should Aussies be shopping around for a new dentist every checkup?
No, that's not necessarily the message that we want to go with. It's worth remembering that whilst we are looking at a very little change in the cost of a new patient visit, the new patient visit is still on average more expensive than the standard checkup and clean. And so it's not so much that people be switching around and constantly taking advantage of new patient offers, but rather finding a dentist that meets their affordability criteria.
The cost of a trip to the dentist is still high, and some argue that dental care should be covered under Medicare. It's a policy the Greens took to the last election.
What one, Greens?
to get dental into Medicare.
But there wasn't much appetite for it.
The mouth is part of the body, and we know that there are really strong links between poor oral health and poor general health. So we need a government to commit to a roadmap to slowly expanding Medicare to bring more dental services in.
The message from dentists:
Your oral health is so important. You know, your teeth, they do not regenerate. It's actually the only organ in the human body that does not regenerate. The longer you wait to have dental treatment, the more expensive your dental treatment will get, because then you will require more complex treatments that will cost more.
Really surprised you didn't do that story, Nels.
I do feel slightly targeted being a Collingwood supporter.
How many brushes are we up to per day?
Today, only 2
Only 2.
so far.
Ooh, that's because you've had a busy day.
been
And how many
busy.
times to the dentist this year?
Only 2. I've calmed down a lot.
I think I'm 1 in 10 years. So we've got a tale of two dentists here.
Absolutely.